Pain is your body's way of telling you that something isn't right. Whether it's a sudden, sharp pain or a dull, persistent ache, it's crucial to pay attention to these signals. Ignoring pain can lead to more severe problems down the line, and in some cases, it can even be life-threatening. As nurses, we've seen firsthand the consequences of ignoring pain and the importance of proper pain management. In this video, we will talk about why you should never ignore pain. We'll discuss some of the types of pain you should not ignore at all costs. We will also look into the concept of chasing pain, something many chronic pain sufferers will be unfortunately all too familiar with. If you or someone you know is suffering from chronic pain, this video is for you, and it is also your cue to do something about it today. Before we get started, please do us a huge favor. Like this video and consider subscribing if you haven't done so yet. And hit the bell icon so you get notified whenever we post something new. Your Wellness Journal is run by nurses, and we aim to provide informative health videos from the perspective of medical professionals who have been trained to care for you. Now, let's get started with why you should never ignore pain. As we already said, pain is your body's way of telling you that something isn't right. It's like an alarm system trying to get your attention. Ignoring that alarm and pushing through the pain may seem like the tough thing to do, but it can be dangerous. Ignoring pain allows the underlying condition to worsen. What starts as a minor issue can turn into a major problem requiring serious medical intervention if you let it progress. But if you listen to your body and get checked out promptly, early treatment can improve the outcome, keep you mobile, and help you feel better. Don't brush off pain. Talk to your doctor if something hurts, especially if it's new or if it keeps coming back. When it comes to pain, there are certain types you should never ignore. These include severe abdominal pain. This could indicate appendicitis, pancreatitis, a bowel blockage, or gallbladder problems. The worst headache of your life. It may be due to a brain aneurysm, a stroke, or carbon monoxide poisoning. It can also be a sign of an infection like meningitis or even dengue fever. Another type of pain you shouldn't be ignoring is low back pain with fever, as this could indicate a possible kidney infection. You should also not be ignoring chest pain. This is very serious as it could be a potential heart attack, especially if it feels like an elephant is sitting on your chest. Calf pain in one leg is also not to be ignored. It could be a deep vein thrombosis or a blood clot. Be especially mindful of this if you are coming off a long flight or a long car ride or train ride. Severe toe pain. This may be an indicator that you have gout. You should also not ignore sudden severe eye pain. This could indicate a possible blocked blood vessel, detached retina, internal bleeding, acute glaucoma, or shingles. And never ignore pain with loss of function, as this could indicate a fracture, nerve injury, loss of blood flow, or a serious infection. If you are experiencing any of these types of pain, never brush them off. Again, ignoring pain allows the underlying condition to worsen, potentially leading to life-threatening complications. Seeking prompt medical attention can prevent bigger problems down the road and get you feeling better faster. So, if something hurts and you're unsure why, talk to your doctor. And if you experience any of the following situations, seek medical attention right away. 1. If the pain is sudden, severe, or rapidly worsening. 2. If the pain limits your quality of life, daily function, or sleep. 3. If there are severe pains like chest pain or headache that may indicate life-threatening conditions. And 4. Pain that persists longer than a few days or a few weeks. So, what if the pain has persisted for a long time? That's what we call chronic pain. If you are dealing with pain that lasts longer than 12 weeks, you may have chronic pain. Chronic pain is a complex condition that can impact every aspect of your life, from your physical abilities to your emotional well-being. It is a type of pain that persists for more than 3 months or beyond the normal healing time for an injury or illness. It differs from acute pain, which develops quickly and usually doesn't last very long. Key points about chronic pain. It can range from mild to severe and is usually experienced on most days. Common causes include illnesses like arthritis, cancer, migraines, musculoskeletal problems, injury, but sometimes there is no obvious cause. It can also likely impact your quality of life, affecting your ability to work, socialize, and take care of yourself. It often leads to sleep problems, anxiety, and depression. Over 1 in 4 adults in the US have chronic pain, and it is one of the most common reasons people seek medical care. Globally, it affects between a third and a half of the population. Treatment typically involves a combination of medications, physical therapy, psychological approaches like CBT, and lifestyle changes. A multidisciplinary approach is often most effective. Now, there is something related to chronic pain that we want to shed some light on, and it's the concept of chasing pain. Have you heard of the term chasing pain before? It's something a lot of folks with chronic pain fall into without realizing it. Chasing pain can happen when you wait to take your pain meds until you're already hurting pretty bad, instead of staying on a regular schedule like your doctor prescribed. The problem is, this approach often backfires because inconsistent medication use potentially leads to worse pain outcomes. The thing with pain, especially chronic pain, is that it can be tricky to manage. If you are not sticking to your prescribed doses, it can be very easy to under-medicate and inversely to over-medicate or abuse pain meds. If you've been prescribed pain medication, don't wait until the pain is unbearable to take them. Stick to the schedule and dosage your doctor recommended. It may be tempting to tough it out, but in the long run, consistency is key for keeping your pain under control. Let me give you an example. Mary is a 65-year-old patient who suffered from chronic pain. Her doctor prescribed low-grade pain medication for her to take when she started to feel pain. Now, Mary has heard that taking pain medication can be bad for you, so she decided to tough it out and bear with the pain for as long as she can. She would only take pain medication when it goes past her pain threshold. Unfortunately, at that point, her low-grade pain medication no longer worked for her current level of pain, and she now has to take a stronger dose. And one of them has more potential negative side effects compared to her original prescription. The point we are trying to get across is this: don't live in pain. Don't bear it out. Pain is not normal. You can live pain-free with the proper medical care. Of course, abusing pain medication, taking more than prescribed, also has its own problems. So, it's always best to stick to the dosages and timings given by your doctor. If you are concerned about the amount or the type of pain medication you are taking, don't hesitate to talk to your doctor about it. If necessary, you and your doctor can look for alternatives that you are more comfortable about taking. If you are looking for some drug-free pain management and recommendations, check out our video on how to manage arthritis without medication. A link to that should be on your screen now. We'd love to hear from you. Have you ever experienced a type of pain that you initially ignored but later realized was a sign of something more serious? Please share your story in the comment section below. We value your input, and it will also be a great place for the Wellness Journal community to learn from each other's experiences. We hope you found this information on why you should never ignore pain and the dangers of chasing pain helpful and eye-opening. Don't forget to like, share, and subscribe to your Wellness Journal for more educational content on health and wellness from a channel run by nurses. Feel free to check out the links to our other videos on your screens now. Take charge of your health today by paying attention to your body's pain signals and seeking appropriate medical care when needed. Ignoring pain can lead to more severe problems, but by being proactive, you can maintain your well-being and quality of life. Thanks for watching, and we'll see you in the next video. We are your Wellness Journal. Have a healthy day.